Hey, Dr. Schiller here. I want to talk with you today about your overall neuromusculoskeletal system, pain in your body. And this is going to be relevant to you if you're someone who gets bursitis, tendonitis, arthritis, or someone who occasionally gets injured or strained. And especially if on top of that, you've got something like fibromyalgia or a chronic illness that makes you fatigued and just like hard to get around, because those processes feed into the inflammatory processes and the neuromuscular processes that can actually give you more aches and pains. And also if you've got anxiety or depression, because it's all a loop and everything's connected to everything else. You are a mind-body system. What's going on in your mind and emotions is affecting what's going on in your body, and vice versa. It's a dance. So I want to share this stuff with you so that you are thinking more broadly when you're having a body pain issue, and that you're thinking more broadly about diagnostics and therapeutics, especially if the orthopedic surgeon or family doctor says, well, I don't know what's wrong with you, or just take these anti-inflammatory drugs and do physical therapy, because that's frequently not the right answer. Most of the time, when you have a persistent pain syndrome, you're not lacking cortisone and you're not lacking anti-inflammatories. You've got a functional imbalance that's causing overuse or irritation, or you've got something systemic that's contributing to inflammation, and that's why you're developing that tendonitis or that bursitis or that arthritis, because your system's not functioning. And that's not what they're looking at in conventional medicine. They're looking at anatomy and not function. I'm sharing this so that you understand that model and have a broader picture, and I'm sharing it because I'm advocating for mindful movement. And I run a program that's really about addressing this lack in conventional care. It's about addressing all the people who fall through the system, or people who want or more holistic, prevention-oriented, get at the deeper roots of the pain and the issues so that you heal the core, rather than just giving a superficial, take this medication, take this injection, fix the acute problem, but don't address the underlying issues that gave the problem. So my premise is like this, that typical conventional musculoskeletal care, like doctor, I've got pain, is often really bad, and it's based on a model that's really narrow. And I have a lot of respect for orthopedic surgeons and neurologists and neurosurgeons and pain management docs and family practice doctors. There's a lot that they do in terms of musculoskeletal medicine that's essential. But there's a way that the model that they train in is really limited. I'm saying that from experience. I trained in some of the best hospitals in the United States and in the world, learning non-operative orthopedic medicine and neuromuscular medicine in a conventional model. And what I can tell you is it's an incredibly narrow model that misses out on four fundamental principles that get neglected and ignored in the hands of most doctors. And these are well-established physiologic principles that we all learned in medical school. It was right in front of us, but it doesn't get applied in the practical care. And in my experience, that's why a lot of people develop chronic pain. They have a pain problem that just doesn't get better. I've worked for over 25 years doing integrative pain management and rehabilitation, and I've been the one that the doctors send the patients who aren't getting better. And there's sometimes I do things where like they're getting better right away. Oh, like what happened? Well, I just had a different perspective, and I looked at it with a broader model. And that broader model brought a therapeutic leverage that let me help someone that had been to 2, 3, 4, 5 different doctors, and they're all like, there's nothing to do to help you. Well, no, wrong. There is something. You just have to look clearly at what's going on and not have your head stuck in a little book that tells you what is and isn't true. Because the textbooks are great, but they're missing a lot. What are the textbooks missing? 4 main principles. The first one is what you could call connective tissue or myofascial reality. And what that means is that we have a 3-dimensional system of connective tissue. Connective tissue is the grizzle. When you look at a steak and you see that whitish stuff, that is fascia, ligament, tendon, connective tissue. And it creates a 3-dimensional web. That's a structural web throughout your entire body. There's evidence that it's a communication system, that the connective tissue is involved in the acupuncture meridians, that when you change its mechanical properties, you change its electromagnetic properties, so it's involved in signaling, that it carries patterns of mechanical tension throughout the entire body, and that's something that every body worker learns to feel and sense and work with, but it doesn't show up on an X-ray, a CAT scan, or an MRI, or even a PET scan. So most doctors don't think about it. They don't get it. And the fact is, when I was in medical school, we dissected away the fascia so we could see the important stuff. But here I am like 30 years later, and the important stuff is the fascia. Hello? So again, it's really important that sometimes you see a doctor to make sure you don't have some other kind of more serious thing, like infection or cancer or nerve damage or neurodegenerative disease. If you've got a fracture and you need to be fixed, you should see an orthopedic surgeon. If you got a herniated disc that's really pressing on your nerve, or you've got central stenosis and you're at risk of losing muscle function, you might need neurosurgery. You know, like, I don't want to go on and say the scary stuff. I'm not saying that there's no point in that kind of care and that conventional approach. The conventional approach is incredibly powerful. I bring that to every patient encounter, but I bring a broader model. And that's where I think I've seen therapeutic leverage with people who haven't gotten better from the conventional medicine system. Okay, so let's keep going. We talked about fascial continuity. Everything's connected to everything else. When you reach up to get something off the shelf, there is a pattern of fascial movement from your toes all the way up to your arm. Everything's connected to everything else. And this is something that is palpable once you start to feel it and look for it. And it's something that is off and frequently part of the problem when someone's having persistent pain. There's things that a person can do to fix it with their hands on, or acupuncture sometimes in good hands. And there's things you can learn to do with this kind of movement or exercise that you do with his full body mindful movement. But let's go on with the model. We've got that fascial continuity issue. We've got the issue of what you could call neuromuscular control. Let's unpack that. You have so many reflexes and so much information and so much coordination just allowing you to like reach up and take a glass off the shelf. Every joint, every muscle has sensors that are feeding constant information to your spinal cord, to the movement sensors of your brain, that are saying, where is that joint in space? How tense are the muscles? How long are the muscles? So that your brain and your spinal cord are able to coordinate smooth movement. It's an incredibly complex process. I don't know how many billions of bytes of information going back, but it's just crazy. It's like, and so what makes a person a great athlete is all that stuff is happening with a tremendous amount of smoothness and coordination and efficiency. But that coordination breaks down when there's pain, when there's injury, when there's fear, when there's inflammation, when there is chronic stress, when there's chronic pain. We have data that show, especially in certain models that get studied a lot, like back pain, when a person has chronic back pain, there is loss of coordination in the way the muscles work. So instead of working together, the muscles are working against each other. You know, you want, and four friends want to pick up something heavy and carry it, but like one of the guys is going in the opposite direction, like everyone's working harder. And when everyone's working harder, things are more likely to get painful. You're overloading tissues because you're not working smoothly. So neuromuscular integration, which is not just one joint at a time, but everything. Everything is moving as one unit. When you're walking and you're reaching up to gather something, talking on the phone, you're running after a ball, you're playing soccer, you're playing tennis, you're just like carrying the groceries and unlocking the door, and then the phone rings or someone's beyond. You know, it's like all this stuff is happening at once. And if your system's not working together, then it's working against itself. And that can lead to problems. It can lead to pain. And so you re-educate that system to function as one unit, and you do better, and you heal. You actually get at the root of stuff, and surprising stuff happens. Okay, so that's the second thing. The first thing was that whole fascial web of connection, top to bottom, bones to skin. There's the neuromuscular connection and the coordination. There's your autonomic nervous system. Your autonomic nervous system is your stress response and your relaxation response. It touches every bit of your body, and it biases you towards the stress response, which is get up and go, fight, flight, freeze, or the relaxation response, which is rest and digest, heal, repair your body. Like that's what happens when the relaxation response is active. Sleep, absorb food, remove waste products, versus I got to get up and go and do stuff. So I'm not healing then because I'm doing and I'm going. So most of us are already biased towards the stress response because our lives are just overwhelmingly complex and fragmented, and we live in a crazy world right now. And if you've got chronic pain or chronic illness, that is even more so, because we know that autonomic dysfunction, which is typically an overactive stress response, and chronic pain and chronic illness are related in a vicious cycle. They feed into each other. It's just typically always part of the problem. You might feel calm in your head, but meanwhile your body is like stress response, fighting, trying to deal with perceived danger, whether it's on a mental level, emotional level, or actual physiological level. What stimulates that? Yes, mental emotional stress, but lack of sleep, altered circadian rhythm, inflammation, unstable blood sugar control, all of these things are stressors. On a physiologic level, your immune system has things called danger-associated molecular patterns. That's what drives immune reactivity and autoimmunity and overactive inflammation. And it's basically your immune system is saying danger, and it's integrating everything, top to bottom, mental, emotional, physical. So all of that's influencing your neuromuscular control system. All of it's influencing your connective tissue system. And if you've got an overactive stress response, then you can't possibly relearn as well, because your system is preparing for danger and trying to deal with the acute, oh my gosh, I got a problem now. It's not about like, oh, you know, I want to feel better 3 months from now. It's like, no, I got a problem now. It's a different emphasis, it's a different bias. Okay, let's go on to the fourth thing, which is what you could call ligamentous articular mechanism. And this is something that I learned a lot from my osteopathic colleagues who I had the real benefit and honor to study with for like 20 years. And it's an awesome concept that has awesome application, which is that, you know, every joint of your body is limited by ligaments. And those ligaments limit but allow motion. They allow physiologic motion, but they prevent too much motion. And typically in all three directions. You know, your wrist goes like that, like that, like that, like that, like that, like that. So you got all these ligaments, and they're in a system that are all working together to allow proper motion and avoid too much motion. Well, let's say you strain a joint. What's going on? You're overacting. You're taking that joint past normal motion, and that creates what we call strain in that joint. The ligaments that were taken beyond where they should be, they get a pattern in them that's a protective pattern, and something gets stuck there. And you know, you develop a skill to look for our ligamentous articular strain, and you feel it. We can't measure it. It doesn't show up on MRI scans or CAT scans or even PET scans. If it's really bad and the ligament's torn, yeah, the orthopedic surgeon will see that and they'll want to fix it because it'll show up in an MRI or an ultrasound. But it doesn't show up because it's a functional issue. And what happens is when you got ligamentous articular strain, it's sending information into those reflexes, into that neuromuscular control that's screwing up coordination and fluidity of that joint. But let's remember, it's not just that joint in isolation, it's the whole body. Everything in the body is communicating with everything else. You have a three-dimensional, one body ligamentous articular mechanism that is constantly compensating and figuring out how to facilitate motion. And it's intelligent, and we can't measure it, and we barely understand it from kind of a quantitative biological point of view, but it's real and it's there. And I could start just listing cases of people that I've seen, you know, the lady with really bad knee pain who everybody thought had a bulging disc in her back pressing on her L4, and it looked like she did. She had a bulging disc in her back, and it sounded like L4 pain, but I put my hands on her feet, and I was like, well, what happened to your ankle? She's like, oh, I had a really bad ankle sprain. I'm like, well, when was that? It was about 8 months before the knee started going bad. Huh, interesting. So I went to work on her ankle, and I just sat there and her ankle unwound and did all its thing for like 25 minutes. And she's like, what are you doing to my knee? And I'm like, well, everything's connected to everything else. And she gets off the table and she just like, my knee pain is gone. Oh my gosh, I've had knee pain for 3 years. They did all these, and they were talking about doing back surgery. I'm like, well, the problem wasn't your knee. The problem was your ligamentous articular mechanism. So some practitioners know how to treat that way. Most don't. Especially most MDs or DOs who train in an MD context, because they're looking for the lesion on the X-ray, the CAT scan, the MRI scan. They're looking for the knee bursitis, or they're looking for the back, the disc, the pressure, but they're not looking at how everything works together. Autonomic nervous system, ligamentous articular system, fascial connective tissue system, and that that whole body neuromuscular control system. Those are integrative systems of health of your body. Typical orthopedic neuromusculoskeletal care is really good sometimes at dealing with the acute problem and making that pain symptom going away, but it doesn't necessarily get at the underlying stuff that's driving that pain symptom. And so I want you to know this information so that you can have a broader perspective on what kind of care you might perceive or proceed with, and so that you can also potentially, if you want to, really develop neuromusculoskeletal resilience, start to learn mindful movement, start to learn meditative practices that bring balance to the autonomic nervous system, and start to work with a yoga, tai chi, qigong, Feldenkrais, Pilates approach where you bring a lot of awareness to the body, and you do very specific exercise that realign and reset those reflexes, that release connective tissue and fascia, and that can also free up those ligamentous articular mechanisms. So I'm advocating for the program that I teach called Movement Towards Health, which is an online training program to train better resilience of your overall mind-body system. And it's geared and designed to address these imbalances and these issues that are, in my eyes, the cause of most persistent pain, and in my eyes are the opportunity or the potential pathway by which a person can actually develop that fluidity and flexibility and retrain and reheal and kind of reawaken the intelligence of your own neuromuscular system to help it heal, to help it function better. So if that's interesting to you, check it out. You can go to the website mthtribe.com. That's movementtowardshealthtribe.com. And there's an information page there. Check it out, see if it's interesting to you. I hope this video has been interesting. Leave me some feedback. Let me know if you like it, if you have questions, if you have comments, send me an email, whatever it is. I'm here to help.